He is the deputy director of the Safra Children's Hospital at Sheba Medical Center, where many of these children who were freed from captivity in recent days received critical treatment physically, but more urgently, more importantly, more long-lasting, their emotional and psychological treatment as well. Dr. Moshe Ashkenazi joining us now at Sheba. Thank you so much, Doctor, for being with me. How many children today at this point are still receiving care with you at your facility?
So according to this morning, still 7 people that were released from captivity were in Sheba Medical Center. One of them is a child. All the rest are adults.
Can you share with me, grown-ups versus kids being kids? Because I know at some point you had many children there being treated together. The children, when they're with you, are they able to hang out with each other? Do they talk to each other and do activities together? And is that perhaps even more important to their recovery to get them to open up amongst their peers in a way that you really can't do when there's an adult in the room?
So this is a good point. The kids, as being kids, we see the recovery is relatively fast. Although I must say nobody has recovered from this 50 days or more captivity. But we see that the children can adapt themselves a little bit faster, and they did it in the compound that was built in Sheba Medical Center. The adults, the advantage of the adults is that many of them were part of the same congregation, the same kibbutz. For example, one day we got the congregation of Be'eri, and the other day we got from Nir Oz. So they know each other, and I'm sure it helped them a lot.
Doctor, the kids, they sadly all have, you mentioned they come from the same communities, the same kibbutzim. They have murdered friends, murdered neighbors, in many cases a murdered family member, even a killed parent. Did they know about that at all until they arrived at your facility? And how did you prepare to break the news to them?
So many of the children during the captivity didn't have a clue what happened to their family members. Some of them have discovered it only when they were released from the Hamas, and they passed the border to Israel, and they asked for the first time, what about their relatives? And this is the point that many of them got the first announcement. Some of them have gotten this announcement in our facility. And we had here a big team of psychologists, psychiatrists, and social workers that are trained in delivering such messages to people, and they were preparing themselves in advance to this moment.
I would imagine still it's a devastating thing, something that never leaves you when you have to tell a child that.
Yeah, I think it's one of the worst moments in each one of us has a career to tell a child that his father or his mother won't be back. We had to do it here, and unfortunately also other hospitals had to do it, and this is the situation.
Doctor, we know that physically the kids, most of the hostages and the kids physically, they're okay in terms of their functioning. There are reports of several children being, branded, being burned or marked, or they were cut in some way, or they have lice and these kinds of things. That's not an urgent physical health matter, but they're indications of torture. Did you see this among several children? Are there burns? Are there marks? Are there conditions with hair that do indicate the horrors they endured?
Look, I cannot go into details what were the findings in the children that were hospitalized in our compound. But I can say that 50 days captivity, it's in conditions that were quite difficult and sometimes extremely difficult, had left some markings and some leftovers in the child's body or in the child's soul. And slowly we could discover them. Also, what happened to their soul and how do they feel psychologically. With the time, we could reveal more and more stories. And I think also from other hospitals, as we all heard it from the family members that were interviewed in the internet websites, the stories are quite difficult to hear.
Is there something that's surprising you, Dr. Ashkenazi, about the kids, especially the children, how they're recovering? Something that you didn't expect with their journey so far?
Look, I was asked this question a few times because we did a very good preparation to this scenario. We trained ourselves with the actors, and we wrote some guidelines how to deal with such situations. But for one thing, we were not prepared, and this is the human spirit. We were surprised sometimes how strong the people that were released, how strong they are, and their strength and the spirit was so strong. But I'm sure it was difficult to everyone, and everyone needs the continuation of the psychological treatment, sometimes psychiatric treatment for the next years, and this I'm sure. And I know that State of Israel is ready and took it on itself.
Dr. Ashkenazi, thank you for spending a few minutes with us today on I-24 News.
Goodbye.